So COVID, you say you are taking extra precautions in your office for COVID. Like what?
You know, as dentists, we've always been cautious about infectious diseases. This is go back to the 80s when before dental school, I remember that AIDS was a really scary thing. I mean, we didn't know much about it. Now we hardly even think about it. There's so many medications. But you know, with COVID, we stepped up one notch. We're disinfecting the counter. We require everybody to wear face masks till we have, I remove the face mask myself in the chair. So
you even wore a face mask in our studio, we should mention, and we're at least 6 feet apart here.
Yes, we are. We're doing a social isolation.
That's right. We didn't even shake hands today.
No.
Which I like that about you, that you are really into this.
Yes.
So at any rate, I interrupted. So also, so you were about to say of all the extra precautions you're doing because of the COVID-19.
So we're doing all, you know, again, we always follow CDC. You know, now here, the public hear about CDC guidelines. I mean, since I've been a young dentist, now I'm a middle-aged dentist, been for 25 years, we have been following CDC guidelines and infection control guidelines since the get-go, from the first day of dental school. In fact, most public doesn't know that, but every year we're mandated to have infection control seminars, and every year dentists been doing it for years. Now we stepped it one notch. We're cleaning the counter. We have face masks. We don't take it out. We disinfecting the door handle inside, outside. We'll bring you in. We have a greeter who makes sure that everybody has a temperature. We take the temperature with the greeter. Actually, I hired a new staff, Andrea, who's up there, and as soon as they come in, we take their temperature. They ask them. We have a form that we ask them if they have any symptoms or anything. Then we don't, we politely ask them to reschedule. You know, who goes to the hospital when you're really sick, right? I mean, when you're really sick and have a temperature, you don't go to a dentist. So it's safe enough. I think my practice, I feel comfortable going there because I have the isolations, I have the mask, I have shoe cover, I cover my head sometimes now when I do surgery. So it's just a safe place. Dental offices traditionally been a safe place to go to. You know, actually people who come to our office, they don't have fever. They don't, they don't test positive. I mean, we don't do testing for positive for COVID. But these are healthy people who come to our practice. Not to say that they're not going to be tested positive for COVID after they live and be exposed to it. Yeah. But we don't allow anybody who's tested positive or they have infection to come to our practice.
So don't let COVID keep you from having the smile you've always wanted?
Oh, absolutely. You know, it's safe enough that we can. I mean, it's still, there's a lot of things we don't know about COVID. But, you know, watch less TV and come see me more often.